The Department of Human Services isn't the only agency facing an uncertain future. Several state agencies whose mission is to safeguard public health and promote well-being are facing challenges even with increased funding. And the loss of revenue from a new cigarette fee could end up blowing a very large hole in already strapped budgets.
The Oklahoma Healthcare Authority, which oversees the state's Medicaid program, saw its appropriation increased by 4.2% in the next fiscal year. While that may seem like good news, the agency could still be forced to cut reimbursements to doctors and other Medicaid providers as a result of projected cost increases. Officials with the Healthcare Authority declined to be interviewed for this story, but did release a statement saying reductions to benefits and provider rates will only be considered as a last resort. Craig Jones with the Oklahoma Hospital Association believes they may not have a choice since the agency had requested an additional $69 million in fiscal year 2018 to avoid cutting provider rates.
Of the $69 million, the legislature only appropriated $32 million from the rainy day fund, so that's half of what they needed. Now, supposedly they're getting a portion of this cigarette fee, but if that doesn't come forward, then they're already behind the eight ball, if you will.
Jones says if the cigarette fee is successfully challenged, it makes rate cuts for Medicaid providers more likely.
Now, we certainly hope that the cigarette fee or a tax or, comes forward, but if in fact it's not, and if no other revenue measures are raised, there's no choice that they have.
More cuts would be devastating to some rural hospitals in Oklahoma.
I can tell you there's probably 9 to 10 hospitals right now that if we get further cuts, we'll find it difficult as to getting to the end of the year.
Reductions in Medicaid reimbursement rates would also impact long-term care facilities in Oklahoma, which rely heavily on Medicaid. Brett Coble is president of the board of directors for the Oklahoma Association of Healthcare Providers.
Even if we don't see a reduction in our Medicaid benefits, our sector is still at risk because our current reimbursement is still so much below the cost that we have to provide care to our patients. If our funding stays flat, then it will force many providers in our state, up to 10% we estimate, to potentially close their facilities within the next year.
Overturning the cigarette fee could also create a very large hole in funding for the Department of Mental Health and Substance Abuse Services. The agency did receive a slight 1.7% increase in next year's appropriation. Oklahoma Behavioral Health Association Executive Director Julia Jernigan believes that shows mental health is a priority for lawmakers.
But saying that, there's still not the funding that needs to be in place to truly take care of the people that are needing help the most. I mean, we have a large statewide list for people to get into addiction services. Oftentimes, people receiving mental health services can't get in until they are extremely sick.
$75 million from the cigarette fee is scheduled to go to the Department of Mental Health. Jernigan says if the fee is overturned, there's no way the agency could absorb that kind of cut.
Our community mental health centers that are a statewide network, a safety network, they would have to start closing their doors. Our addiction facilities, both outpatient and residential, would start closing their doors. I mean, it would be a true devastation to the provider network.
One agency that is not scheduled to receive funding from the cigarette fee is the Oklahoma Department of Health. But Health Commissioner Terry Klein still hopes the price increase will remain in place. Klein says his concern is keeping tobacco out of the hands of kids, something he believes the cigarette fee will help to accomplish.
There will be about 28,200 kids who will not pick up the habit who would have otherwise. They're just priced out of it, so they're not going to do it. And there will be about 30,000 adults who will quit.
Well, Oklahomans' health has improved in recent years, with rankings rising from 49th to 46th among the 50 states. Klein says that's not good enough.
I don't think any Oklahoman, and I know I'm not happy with being at 46th, because it's really a reflection of dire circumstances for the people who live in our state to be in such poor health.
And tobacco plays a major role in those poor health outcomes.
And in Oklahoma, we have about 7,000, at least 7,000 people every single year who are dying from tobacco-related illnesses. That's a lot of death.
Budget cuts are another factor in the state's overall health rankings. The health department's appropriation fell by just 2.8% next fiscal year, but the agency has seen a 30% decline in its budget since 2009. Cuts which Klein says put the ability of the agency to protect Oklahomans' health and promote a healthier environment at risk.
We've had to make some really hard decisions that I don't like having to make because short term, it's what you have to do, but long term, it's very poor for our state.
Klein says as a result of the latest budget cut, the agency may have to cut back or eliminate some programs and reduce payments to federally qualified health centers. Those centers provide primary care services to people without insurance who would then be forced to go to emergency rooms to seek treatment.